Hello, my name is Ilias Paschopoulos. I am a sports MSK physiotherapist, and today we're going to talk about something niche in my practice, which is called TMJ disorders. What TMJ stands for is temporomandibular disorders. Is the joint that connects the jaw with the skull on each side of our mouth, basically, and is responsible for mouth opening, chewing, speaking, a lot of different things that we do in daily life. Some of the symptoms that we see with clients having some disorder over there is normally clicking or popping sounds into that region over here. Sometimes the pain refers either towards the ear or comes forwards into the face, ear, or cheekbone. Also, we have some limitation in the mouth opening. Some people, they're struggling to even chew on that side and they avoid chewing on that side. And also we see some deviations a lot of the time. So the jaw opens to one side more than the other, or like a Z movement, how we call it, which basically does a Z movement and comes into place. In an extreme scenario, the jaw might lock, which means basically as you open, stays there in this position and doesn't go back into its place where it's supposed to do. How we diagnose? The diagnosis on that is predominantly clinical, meaning you don't need some scanning like MRI, X-ray, or anything like that, unless we suspect something sinister, either a fracture, arthritis, or something trauma-related. So clinical diagnosis is basically a lot of history to understand a little bit what is causing it, because it's a multifactorial issue. So we take the subjective assessment with a lot of specific questions about the jaw, mouth opening, and everything related to that. Then we will proceed with the assessment. Assessment is outside of the mouth, basically. So we start with masseter palpation on the muscles, and also we have some palpation into the joint. And then we proceed into some oral examination, how we move the joint when it's open, and then we do some special tests to diagnose it. For the treatment, again, our assessment guides our treatment plan, of course. So there are main two categories of the TMJ: is either arthrogenic, which means the joint is the issue, or myogenic, which means the muscles are the issue. So depending which is, we have a lot of different techniques that we use. Combination is manual treatment, orally and extra orally, so inside and outside of the mouth. And also we use some acupuncture if it's a muscle related issue. And also we have some exercise prescription in the end to help restore the function of the mouth. Also to mention that, yes, we are physios and we help as much as we can on that, but it's really, really important to address that on an MDT environment, meaning psychology needs to address, dentists need to be addressed also and help with that issue, because it's a multifactorial issue and it's not just one thing. Thank you very much for your time.